And welcome everyone to the CARPHA, CariPHLN Biosafety and Biosecurity webinar series that's being held in collaboration with the US CDC's Collaborating Center on Biosafety and Biosecurity, the WHO designated Biosafety and Biosecurity Center, and our colleagues from the World Health Organization's headquarters as well, on this series about the WHO's newest release, the Laboratory Biosafety Manual 4th edition, the LBM-4. And today in the second session, we'll be focusing on risk assessment. And for those of you who have joined us in the first session, we listened to what you have said in terms of what's important as future topics, and risk assessment has been of the highest priority to everyone. So we welcome you all, and as I mentioned in the chat, we've seen colleagues joining us from all over the world, and so we welcome you today. My name is Sasha Wallace-Sankersay. I'm the Biorisk Manager at CARPHA, and it's my privilege to share with you the agenda and some welcome remarks for today. So the objective of today's session is to provide guidance, including examples for the use of the risk assessment monograph of the new WHO LBM-4. And our presentation today will be by Dr. Christina Shield. She's a health scientist from US CDC's offices out of Georgia. And she has an exciting lineup for all of us. I'm here to learn as well. And this will be followed by a question and answer session. I want to note the presence of Dr. Kaz Kojima, Dr. Rika Zinski, and I believe Dr. Catherine Mackison Booth have all joined us today. And along with Chris, they have been really the backbone of the risk assessment monograph and the authors and experts in this risk assessment that we're going to be talking about today. So this is the opportunity to ask the questions that you may have milling around for a long while. And as we hope, you will be implementing risk assessments in your own facilities after this and improving on the risk assessments that we have done. You have the experts here today with us, so we'll have that question answer session. And based on feedback from the first session, a lot of persons asked for us to be able to have a sort of after party. So at the end of the session, as we draw to a close, we will be allowing you to open up your mics and cameras so that we can share more informally. We'll see how it goes because there are quite a number of us on the call, almost clocking at 100 right now. But we do encourage you to stay on to see who our colleagues are from around the world and to ask the experts additional questions. So at this point, I'm going to ask whether or not Dr. Gabriel Gonzalez Escobar, the Assistant Director for the Surveillance Disease Prevention Control Division, also the head of Laboratory Services and Networks, where I work from, is online to bring a few remarks on behalf of our colleagues at CARPHA. Dr. Gabriel?
Thank you, Sasha. Good morning, everyone. I'm very happy to be here. I'd like to tell you that I'm now back in CARPHA after 2 months. So it's very nice to be here, and it's very nice to give you just a few words with regards to the great collaboration between the sister health agencies like the US CDC, CARPHA, WHO, PAHO, etc., etc. It's very good to see a combined effort of all these agencies to organize and to have these sessions, these very important sessions. I'm very happy. I'm also very happy to tell you that CARPHA is a commitment from CARPHA to continue to support these activities and to recognize the importance of these meetings and the subject the subjects that are discussed during these sessions. We are very happy to have you all. I'm very glad to see that we have more than 100 participants, which is a very, very interesting figure. I look forward to a very productive session, and I wish you all the best to you. And please, my last message to you is please, please, please stay safe. Thank you very much and have a good morning.
Thank you very much, Dr. G. That's what I call him. And at this time, I'm going to stop my screen share and I'm going to hand you over to Dr. Christina Shield, who will take us through today. And don't worry, Dr. Christina has built in a few surprises in her presentation for us. Chris, over to you.
Thank you so much, Sasha. And I'm really happy to be here today to share this material with you because I'm very excited about it. I'm also happy that you made such a nice introduction for Rika and Kat and Kaz, and I'm looking forward to the Q&A session with them later. So I'm going to kill my camera so we can just get started and share my slides. Go. Second here. Let me know when you can see this. Let me.
Yes, they've come up.
Big.
Yeah, but it's
I'll
not
make it
presentation.
big. Okay, is that better?
Yes.
All right, wonderful.
Excellent.
Wonderful. So today, of course, I'm going to be talking about the WHO Laboratory Biosafety Manual 4th edition risk assessment, and that includes the risk assessment monograph. Today, my aims and the aims of this webinar are for you to increase your understanding of risk assessment principles and methodology, to show you the value of risk assessment over the traditional prescriptive classification system, to show you how to perform a risk assessment, and for you to feel confident in sharing the information that you've learned with people in your own laboratories and with others. I will be talking a bit about the topic of risk assessment in the LBM4 and monograph, and I'll be explaining what risk assessment is, also the value in practice or the importance of it or what it does. Then we'll go through some examples and how to do it, and then we actually have a practice session. So we'll all be working together as best we can on a risk assessment. And then finally, I'll have a few take-home messages for you. Okay, first, there's a poll question here, and I'd like to know how many of you have actually performed or are continuing to perform biological risk assessments for procedures in your laboratory. There should be a poll question popping up for you. Please answer that poll question, but due to the sake of time, I'm just going to continue on and allow you to answer that on your own. All right. So the Laboratory Biosafety Manual describes the essential risk assessment framework, including the principles and processes of risk assessment. And I may be saying RA frequently, which will be risk assessment, because it gets very tongue twisting after a while. So also key considerations for risk assessments and the stepwise process of the risk assessment or approach of the risk assessment framework. That is the document that you should first turn to learn about risk assessment. And then for more information and to get complete treatment of the topic, please refer to the risk assessment monograph. The monograph provides in-depth information about RA and builds upon the principles and practices in the core document to include a risk assessment team, which we won't really discuss today, but it's quite important, the applying of controls to reduce risks, which we will talk about quite a bit today, sharing of lessons in the field, and providing, it provides blank and completed RA templates as well. And so we're going to actually use those today during this session. I also want to say that the manual and monograph provide guidance and promote individual and local risk assessments, which is very important because it's based on the resources you have on hand, and it's a very equitable approach. It's also intended to complement but not supersede any national regulation and oversight mechanisms that may be in place. So what is a risk assessment? There is a definition that I pulled directly from the LBM-4, and the poll just came up already. Okay, a risk assessment that this is directly from the LBM-4 and the risk assessment monograph. It is a systematic process of gathering information and evaluating the likelihood and consequences of exposure to or release of workplace hazards, and determining the appropriate risk control measures to reduce risk to an acceptable risk. Okay. Shrink something so I can actually read my slides. Okay, there we go. So one important thing is that risk assessment supports an overall risk management strategy, which can be at the institutional level or even at the national level. Information about potential exposures or releases of biological agents should and do figure into the larger enterprise risk management strategies of organizations. And this can aid in planning and funding for purchase of supplies to control these risks and prevent laboratory incidents that could cause harm. Risk assessment is situational, as I mentioned before, in its approach to laboratory biosafety, and it is evidence-based. This allows for greater flexibility for laboratories to apply appropriate controls to reduce risks associated with their work based on their available resources. It is not fixed and inflexible and has no hard operational requirements associated with it. This is a departure from prior approaches. Okay. I think I'm stuck. I think it's the poll. Hold on one moment, folks. Because I can't advance my slide right now. Okay.
Hi, Chris. So
Hi.
I think we could just take a pause. I think the poll has ended.
Oh, okay. Is that what the pause is? Because I'm like, I can't advance my slide. I'm sorry, folks. Okay.
Can you see the results? Maybe you can share with them.
Oh, I did see the results, but I closed it. Did that go directly to me and I was supposed to share it? I am so sorry.
No, that's okay.
Yeah, it's on the screen.
Share at the end. Why don't we share at the end if that's okay?
That's
I didn't expect to have to share that. So to another important point, I'll continue. Forgive the break, folks, is effective control of biological risk is the cornerstone of laboratory biosafety. Okay. And so a shorter definition of risk is the combination of likelihood and consequence, where likelihood is the probability of an incident, exposure or release that can occur during the course of laboratory work. Consequence is the severity of harm caused by an incident occurring during the course of laboratory operations. So on the left, we have procedures that are being done that could cause aerosolization, pipetting, vortexing. And so that is something that would contribute to likelihood. Consequence is shown on the right. If there was an exposure, it could result in hospitalization, or if it was a pathogen that affects the environment, it could be much larger than that. We'll soon get back to likelihood and consequence, but I'd like to describe the risk assessment framework, which is illustrated in this figure. And this figure is found in both the ALBM4 and the monograph. There are several steps in the framework, and we're going to discuss these individually later in this talk. The first is gathering information about the work being performed, and then evaluating the risks, then developing a risk control strategy, and selecting and implementing control measures, and finally reviewing the strategy and controls in place and adjusting as necessary. This is especially important when changes are made to a procedure or equipment or staff, or if an incident has occurred, which would indicate the need to review the measures you have in place. And it's a circular process, not linear. It's a plan, do, check, act cycle. There we go. And so now we're going to begin going through the steps of the risk assessment framework. As I had said, we will first gather information. Information about the biological agent is very important. Its properties such as pathogenicity, transmissibility, whether it's endemic to your area, and so on. You need to gather information about the type of work that'll be performed. Will it involve the use of needles, sharps? Will you be working with large volumes? Also, what type of laboratory equipment you'll be using, will you be needing to use centrifuges, pipettes, vortexes, shakers, all of which can produce aerosols? And your facility is also a factor. What type of, is it a new facility, an old facility? Does it have breaches? Those types of things. And then human factors. Are your staff well-trained and competent? And then other considerations you may think of, regulatory particularly, also cultural, public perception, political, and others. So these are all the types of information that are gathered when initially performing a risk assessment. Over the next several slides, I'll be talking about evaluation of the risks. And so I have this as a single slide to let you know there's probably 6 or 7 slides that follow this that talk about this topic. And that was the second step. Likelihood of an exposure or release occurring in the laboratory work is categorized in from rare to almost certain. Remember that I said risk is a combination of likelihood and consequence. Rare means it's almost impossible to occur, and almost certain means it's highly probable to occur. And this is a way of categorizing or gauging the risk, or the likelihood involved. Factors associated with high likelihood are aerosol formation, the use of sharps, low competency of laboratory personnel. If your pathogen has high environmental stability and lingers on surfaces, that will increase likelihood of an incident. Any equipment that malfunctions, if there's poor availability of infrastructure and services, or if you have breaches in your building, that is also a high likelihood factor. All right. Severity of consequences. These range from negligible, which means trivial or non-existent, and this could include near misses, requiring maybe reporting and follow-up. Minor consequences would be a self-limiting illness from one of your biological agent. Moderate consequences would indicate that medical attention or treatment is required, or it has an insignificant environmental consequence, and/or. Major consequences include potential lost time due to infection with your biological agent, but non-permanent illness, and also limited environmental impact, so and/or that. And then severe consequences are potentially fatal or serious illnesses with permanent disability and serious environmental impact. So you notice that the environmental impact are major and severe consequences. Factors that are associated with greater consequences if an incident were to occur is low infectious dose of, these are all, almost everyone relates to the biological agent. Low infectious dose, high communicability, high severity and mortality of disease, limited availability of prophylaxis and treatments, having a large population that's susceptible to this biological agent, and lack of endemicity. In other words, is this an exotic, considered an exotic disease where your laboratory is? There are also factors that are associated with both high likelihood and greater consequences if an incident were to occur. The first is a high concentration of biological agent, a high volume of that biological agent, or a very large number of samples containing that biological agent. The second is if it has an airborne route of transmission. So now we're going to go and we're going to determine our initial risk. Okay. An initial risk, I'm going to define that for you, and this is found in both the monograph and the LBM-4. It is risk associated with laboratory activities or procedures that are conducted in the absence of additional risk control measures. Okay, and I put in the additional because you may already have some control measures in place when you perform your initial risk assessment. So that was why I added that little word in there. But I think you'll see why when we continue. So what determines initial risk? We've talked about most of these. How can an exposure or release occur? How likely is an exposure or release? What are the consequences of an exposure or release? What can influence the likelihood or consequences? And we've already talked about all those things to some extent, and what measures are already in place. Like I said, these are measures that you already have. You determine your initial risk based on the controls you have in place already. What is the overall risk of the activities? What is the average risk? If you were to combine all risk of every activity, what is that? Is the risk acceptable? Acceptable meaning, if you were to, if your risk, is that risk tolerable to you? In other words, the risk outweighs, keeping that risk outweighs the benefits, or the benefits outweigh the risk. I have that backwards of completing the project, let's say. The benefits of the work you're doing are so important that you'll take a risk. Whatever that risk is, whether it's a high, medium, or low, you think it's that important. So that's acceptability of that risk. And so if no, can that risk be controlled? And here I have an example of the simple template. And this is found in, I believe, it's one of the annexes, probably one of the first annexes in the monograph. That's where all the templates are, in the annexes. And this shows you, I know it's hard to read, but you can see that it has the step 1, gather information, hazard identification. Step 2, evaluate the risks. And then it has this table where you're basically combining likelihood and consequences. And this is an easy way to collect this information, record it, and to determine how much risk is that you have initially, and how controls you might add could lower that risk. And so I'm just showing you this blank template here. Okay. And we'll go into this a little further. This is a more complex activities. We have 5 categories of consequence and likelihood. And that was what I described when I initially described the classifications of those, ranging from negligible to severe for consequences of exposure release, and from rare to almost certain for likelihood. That is a more complex assessment. And I think for most activities, you would use this. The simple form can be used. It's more for a very simple process, single process, or a snapshot to get a better idea of the acceptable, what risk is involved with any activity you plan to do. On the right-hand side, beyond the table, you can see that although we have these categories here describing consequence, likelihood, the levels of those, high, low to high, and also the risk, you can see that it's more of a continuum, that it's not exactly that cut and dried. As you can see, this even shows that if you're doing activities where the risk is low, which would be the left corner, the green area, that's most of the activities you would perform in a lab if you had adequate controls, risk controls. And so those would be considered core requirements. Heightened control measures would be used. In the case of procedures, you'd probably want to lower that risk to a lower level, but it's a matter of acceptable risk. But heightened control measures should be used if the consequences are severe and the likelihood of exposure or release is possible to likely. And then finally, very few of us ever use maximum containment measures, but this is showing that if you have a very severe consequence and likely exposure release, this is in this red zone. And the idea would be to take it from here, add in controls, and lower it to a level of risk that is tolerable. Again, how do we do that? Well, we develop a risk control strategy. And in this strategy, this is an example. We don't know what that procedure is, but it shows that a initial risk was determined to be medium to high in this yellow and red range. And the risk controls were added to lower that risk. And so the resulting lowered risk is called the residual risk after controls have been added in. This appears to be low to medium, and this has been accepted in this particular instance as an accepted risk. And so the laboratory activities can begin. And so as I showed you before, you want to lower the risk to a level that is an accepted risk. So in developing a risk control strategy, you need to, the primary focus of this is determining what resources you have. If you don't have the resources, you can't control the risk using, a certain strategy. So that's the first thing that you would look at. First, what resources are available for risk control measures? Maybe more importantly, what risk control strategies are most applicable for the resources you have available? You could look at it the other way. Are the resources sufficient? What are the advantages and disadvantages of different types of controls you might apply to lower risk? Are the proposed control strategies effective, sustainable, and achievable in the local context? And finally, are there any requirements or regulations that would mandate that you used a specific control measures? Also, you need to consider whether you'll be working with core requirements, as I showed in the previous graph, heightened control measures or maximum control measures once controls are applied. So what do? You develop a risk control strategy. These are different types. Sorry, I'm going to go back one. Okay. These are different types of strategies. First is elimination, basically eliminating the hazard. You could also eliminate a product or some kind of reagent that also might lower a risk. But one way to do that is to use an activated biological agent instead of a dangerous one, or a harmless surrogate. Reduction and substitution would reduce the risk by using, if it were viral, an attenuated or less strain or a less infectious biological agent. You can reduce volumes and titers, as we mentioned before. That's higher risk. Change the procedure for one that's less hazardous, such as PCR rather than culture. And isolation. This is not used as often, at least in a reference laboratory type setting, but it is utilizing a primary containment device. This could be a a glove box or something that basically contains the organism or biological agent to a specific place. And then protection. This is probably one of the most commonly used because it's not always possible to eliminate or reduce or substitute for the work that you're doing. And so this includes PPE, use of engineering controls, including like a BSC, and also vaccination would be included in this risk control strategy, and then compliance. This is extremely important. It's critical to have administrative controls in place and an effective biosafety program and perhaps a biosafety officer. Always good microbiological practice and procedure observed by personnel is critical. Having good communication of hazards and risk control measures, SOPs, training, and of course, establishment of a safety culture. Here are more examples of risk reduction. This is a figure from the monograph, and it shows decreasing risk. Perhaps you're performing in vivo propagation. You could reduce your risk by using in vitro propagation if possible, and then virtually eliminate your risk by using nucleic acid-based assays instead. Also, pathogenic strains, risk can be reduced, as I mentioned before, using attenuated and inactivated would eliminate the risk. And then, of course, decreasing volume would decrease risk. As you decrease this volume, your risk goes down. Okay, and the next step is selecting and implementing risk control measures. Things that you need to consider. Are there national and international regulations surrounding the risk control measures, or maybe the biological agent that you're working with? And what measures do you need to take to comply? And if that's the case, are these efficient? And do you need additional control measures to enhance the safety and lower the risk even further? What is the residual risk that you've measured? Is it tolerable? Do you accept that risk? Do you have enough resources to continue with your risk control strategy throughout operation or baseline operation? Can you maintain that or sustain it? Are additional resources needed in order for you to implement the control measures that you've decided on? And have personnel been trained to implement the control measures and understand, or the risk control measures, and do they understand what the purpose of that is? So those are all very important to consider before implementing risk control measures. So finally, I just want to talk about tolerable risk, which is the same as accepted risk. And I threw that in there because you'll hear it both ways. But it is important to note that risk can never be completely eliminated unless the work is not performed at all. There's always some form of risk, even if it's a slip and fall in the lab. If you're doing a procedure, there's some risk involved. So if you cannot lower the risk to the extent that it's accepted, then you probably don't need to do the procedure. And I am going to go ahead and take a break and give you all 5 minutes so that we can take a break, get coffee, because this is quite a long presentation. The most of it is completed at this point, but we have Q&A. So please take 5 minutes and then come back. Let's see, what time is it now? It's 10:39. Please come back online and we'll start going through the exercises. I'm very excited about it.
Thanks very much, Chris. Well-deserved break. And please, colleagues, place your questions in the Q&A box. Okay, specific questions
Oh, that's good.
relating to the presentation, please place them in the Q&A. And of course, we continue to encourage you to use the chat for the more informal. Thank you. We're glad to see so many of you from around the world joining us. And so any questions for Chris? Maybe you have a particular risk assessment you're in the process of doing right now, and we can use that as an example as well. So looking forward to seeing those.
Very much. I have some examples. Oh, wait. Oh, I am on. Okay, I have some examples and I'm really looking forward to going through those. But meanwhile, I think this is a good time for me to go through the questions. So I'll do that.
Thanks, Chris.
Sure.
Very nice, colleagues. We're seeing questions coming in, so we encourage you to put your questions in the Q&A box.
Okay, I think it's time to start back again. Am I right? I think I even gave another extra minute. So let's go ahead and get into the exercises. I have a question that I am not going to answer yet. I think I'll save it for the panel. And the question, well, we'll save it for the end. I did answer one question about residual risk, and that is in the Q&A box. So, wait, I'm going to close this. All right. Is there a reason that I'm unable to advance my slide again? Oh, there we go. Okay. Might have something to do with polls or questions. All right. So moving on, the first example is for tuberculosis. And this is actually straight out of the book, the monograph itself. And it's a good example of something that is commonly done, and it's a simple procedure. And so we're going to go through the short version, which comes from Annex 3 of the risk assessment template. So first, I think I got ahead of myself. Oh no. Okay. So first describe gathering information. We're describing the biological agent and potential hazards. Many of you know about Mycobacterium tuberculosis, but it's spread through airborne. I want you, one thing, I do want everyone to be considering what when we look at each of these factors, will it increase risk? Will it lower risk? In other words, does it increase the likelihood or consequence? And so be thinking about that as we go through this, and you can probably have a good idea of what risk might look like, particularly for these simpler risk assessments. So they're going to be testing TB in clinical specimens, so there's no culture involved. So it's infected tissues and other body fluids. We know TB is airborne and spread by other routes, but that's the important piece. It's got a very low infectious dose, less than 10 bacilli. It's highly transmissible. There's immunization, but it's not routinely available. And antibiotics are available. Good thing. And MDR, or multi-drug resistance, is not expected to be seen in this laboratory. And then we know it's susceptible to bleach. So the next thing we're going to do, gathering information, we're going to describe all the procedures, the equipment and PPE, the facility type and condition, human factors involved, and other factors. And we went through this before the break, but you can kind of see an example of what it looks like in short form. Laboratory procedures include specimen receipt and recording, direct smear and microscopy, autoclave and disposal of waste. The autoclaving is done in-house, and disposal of waste is by external contractor. Cleaning of the laboratory after any spills. PPE, laboratory and latex coats. This is now I'm onto equipment, pardon. PPE includes laboratory coats and latex gloves. And then they list the equipment they have here in the lab. And next, they describe the type and condition of this facility. We didn't get into a lot of detail about that, but here they describe their laboratory in a room next to a patient waiting area and a specimen collection phlebotomy room. So it seems to be kind of wedged in between some areas where contamination could be a problem. It's an older facility with some cracked vinyl tiles on the floor, screened windows. So there's no protection from the elements during the day, and open doors. They do close them at night. Bench tops are impervious to disinfectants, but there's cracks. And then other things of note is that the important thing is There's only one sink, and it's used for staining of the slides and hand washing. So this is a shared sink for both purposes. Relevant human factors include competency training, attitudes, and personnel. In this case, personnel are trained on laboratory biosafety and compliance, and it's generally good among senior personnel. Personnel turnover, particularly of younger colleagues, is high. They don't have adequate mentorship, so this could be a problem. And then job aids with photographs are placed around the laboratory to remind personnel of safety procedures. And then the last thing, there is another factor. They're saying that there is occasional crime in the area, burglary, but most of it's related to computers and office supplies, not the lab. So now we're in the process of evaluating the risk. We talked about all the factors. We gathered information. What are the potential situations in which exposure or release could occur? The lab says aerosol exposure to or release of M. tuberculosis from a spill, contact with contaminated surfaces, improperly treated waste, all very reasonable. What is the likelihood of an exposure? And this of the initial release occurring, aerosol exposure to or release of TB from a spill, they consider that possible. Contact with contaminated surfaces, they consider that possible. And then improperly treated waste, consider possible. So this is a very, the short form, there's only 3 choices. So everything is kind of in the middle there. And then what are the severity of consequences of an exposure? Moderate, based on the characteristics that we talked about for Mycobacterium tuberculosis. So overall, the likelihood of exposure and release, because it's possible likelihood, moderate consequences, is medium. Okay. Oh, wait, sorry, I went through that. So should the work proceed without additional controls? It's very much dependent on the accepted risk. Most, because it seems that the risk could be lowered, possibly by using additional controls, probably they should investigate adding controls to lower the risk. So they're going to say no. I would say no. So the next step is to develop a risk control strategy. This is about resources, if you remember. Describe the resources available and consider their applicability, availability, and sustainability. So the question, are they sufficient? Yes. PPE to maintain potential risk control measures. Yes. PPE is provided and available, but no additional PP is available. Describe measures advised by guidelines. They say limited financial resources are available and they can't buy any additional PPE or safety equipment. So will they be able to proceed without any risk control measures? Unknown. They can't do any further testing or more complex testing like liquid culture, particularly if there's MDR-TB suspected. So at this time, that's the information that they're giving as far as their risk control strategy. But they do have some control measures that they've selected. And looking at this table, they are able to lower their risk using these particular controls. Now, I want to point out to you that on the left, they're not trying to spill anything. Describe where and when risk control measures are needed. So they're needed to prevent the spill of patient specimens. And what did they add as a risk control measure? Their initial risk, remember, was medium. They added a transport in a sealed container. So they're reducing the likelihood that a spill will occur. And so the residual risk after the control's been added is low. Likewise, for contamination, spill or contamination of patient specimens, they added wearing gloves during all procedures. So apparently they weren't doing that. And then also very important, they're going to use a different sink. And so that went from medium to low. The residual risk with the addition of these controls has now become low. And is it acceptable? In both cases, they say yes. And the measures are sustainable. They haven't really added any particular PPE. They're just changing their practices to the extent where they're improving their best practices during their working, during their work, changing the sink so they're not washing their hands in the same sink they're staining in, and so on. And then finally, they did mention they had sharps containers, but they might not have been using them, so they've added those in, reduced their risk there to very low. And then improperly treated waste, that also is very low. So these are things that cases where they were able to reduce their risk from medium to low. And then this is an example of residual risk after you've selected and implement risk control measures. It was medium because it was possible moderate, if you recall, and that's in the center here. I don't know if you can see my pointer, but they've reduced the risk to low. And so this is the form, and basically requires a signature, which is always good practice from the laboratory manager. And so that is example one of a completed risk assessment that is in. There are many examples, and there's some very complex examples in the annexes. So please do look at those. Two short examples that we're going to do now that you kind of understand where how these forms are laid out and what kind of information we're collecting and what we're doing with that. We're going to look at one biological agent, which is SARS-CoV-2, and two different activities, both tests. The first will be the antigen diagnostic test, or AGRDT, rapid diagnostic test, or MPCR, which is pretty standard. So let's go ahead and go through this. So we're back at the step one with the AGRDT, gathering information. Now, we're all familiar with this test, that it can be done in a doctor's office, so keep that in mind. And so we're going to describe the biological agent, and that's SARS-CoV-2. We know what it is. We know it has high transmission, that it's vaccine preventable, but there's a lot we don't know about it yet. So for brevity's sake, and also just because there are many things that are unknown, we're just going to include that information here. Describe the procedures to be used. What procedures do we need for this test? Not much. Basically, a nasopharyngeal swab is taken in the doctor's office. It's carried in a tube over to this lab, and then it's applied directly to the test strip. There's no disruptive techniques, no vortexing or pipetting, and they estimate 50 times a day they do this procedure. And then describing the types of equipment to be used. PPE, they're using full PPE, gloves, full gown, and 95 mask. They're also working on an absorbent towel in case there were a spill, that it would not, that it would be collected on the towel. And then the type and condition of the facility. It's a small lab and an MD office or a doctor's office with dedicated space. It's not near any type of equipment or paperwork where people would actually handle them with bare hands. So that's good. And then human factors, their staff is trained and competent. They have one experienced staff and one brand new, but it doesn't really play in here because the procedure is so simple. If somebody's trained to perform an antigen test, it doesn't require a lot of training. So, if they've already been proven competent, I don't think that this is as important for this type of a test. Doesn't increase likelihood as much. Describe any other factors that may affect the laboratory. They say the lab can get busy and crowded during peak hours. So that could be a problem. If there's too many people in there, things can get knocked over. So we're going to now evaluate the risk, and we've already collected the information. So they ask what potential situations are there in which exposure or release could occur. Contamination of surfaces is the #1 situation where exposure or release could occur. There's not a whole lot of liquid being handled. Basically, it's going to be the dropping of a swab or something similar. What is the likelihood of exposure or release occurring? Pretty rare. This is very straightforward and very little handling is required. Severity of the consequences, minor. And this is because full PPE is being worn for this kind of there's no biosafety level involved. It's a test that can be done anywhere pretty much. And so they're wearing all the protective equipment they can. There's really no way to further reduce the risk much. They're working on a towel, trying to prevent direct contact with the bench. And so I used the more complex form for likelihood and I'm sorry, the risk assessment form that shows the 5 different categories of likelihood and consequences. And so they have said rare likelihood and severity is minor, so very low risk involved. But they do still develop a risk control strategy. They did have the issue of the lab being crowded. Are resources sufficient? They haven't said that they have problems with that. Yes, they're maintaining their risk control measures. They are going to limit staff entry. They did have a sign on the door, and so they're not going to allow any more than 3 people in the lab, which was something they had been lax about. And then we'll be able to proceed without any additional risk control measures. Yes, it will. And so the initial risk was determined to be very low. If this is the case on initial risk, if it's low or very low, very likely no additional risk control measures are needed. So no other action is needed, and the initial risk is acceptable, and nothing else needs to be done. The SAR obviously review of procedures if this continues, but note that this is an outbreak situation, and so might be somewhat limited in nature. SARS-CoV-2 could be forever, we don't know. But SARS-CoV-2 PCR, this is a completely different test. We won't go through the information about the organism because we already have gone through that. But the procedures for PCR are very different. Pipetting, vortexing, centrifugation, all of these create aerosols. Also, more waste handling is involved. And then they do testing with lots of specimens. So that increases likelihood, if you remember, and also consequences. That was one of the factors that increases both of those things. The types of equipment to be used, they use all that equipment that creates the aerosols, and they have PPE, gloves, full gowns, and N95s, and they use an autoclave. Their lab is a nice lab, 5 years old, reference lab, dedicated space, very modern, impenetrable surfaces, and has negative air pressure or outward air flow. Relevant human factors include competency training, and we discussed that earlier. It seems like all their staff are trained in biosafety and competent in PCR, so they're well-trained staff, not an issue. But they do have another factor that's affecting their operations. They are low on funding. They're in a situation of surge capacity, and they don't have adequate supplies guaranteed. So sometimes they wear their gloves and lab coats longer than they're supposed to be worn. They don't change them out every time. And so that's a problem. So how can exposure or release occur? Now we're going to evaluate the risks we just described. Vortexing, all these aerosolization procedures, plus the reuse or overuse of gloves and lab coats. What is the likelihood of an exposure or release occurring? They say possible. Yep. What is the severity of consequences of an exposure or release? Of negligible, moderate, or severe, they say moderate. So they are also in a position where their risk, their overall initial risk is medium. So now they develop a risk control strategy. It seems that they need one with a medium risk. Are the resources sufficient? This was their problem, not at this time, but they do expect a bolus of funding for COVID at the end of the month. So it's quite possible that they get this COVID funding and are able to get the supplies they need. Describe any measures advised by guidelines, policies, and strategies that need to be in place. Work should be performed in a BSC. They are not using a BSC. And WHO guidance is that they do use a BSC. It's not currently in use and it's not operational. And will they be able to proceed without any of the risk control measures? Are there alternatives? They say no. This is their first risk assessment. They're reusing gloves and wearing coats for days that are disposable. And they really, they can see that the risk is too high. They know they have money coming. So in this table, this is very typical of an outbreak, but not of regular laboratory operations. So this example and the one just prior of SARS-CoV-2 are a little bit different than your baseline operations risk assessment, because a lot of it is dependent on money and kind of short-term solutions that may become long-term, as I said, but it's a little bit different. But for brevity's sake as well, it's all dependent on funding. The laboratory activities and procedures that they want to control, that they need to add additional controls to based on their initial risk are, lacking a BSC and PPE reuse and overwearing, as we mentioned. So with this funding, they'll be able to not only get their BSC certified and be able to use it, but also they should have funding for adequate PPE moving forward and won't have to reuse. And so they've reduced their risk to low. Their residual risk is acceptable, and the risk control measures are available, effective, and sustainable only for the duration of the outbreak and funding. And that's the way that that would probably play out. So finally, this is the overview of what they've done. Their initial likelihood was possible, and their consequence was moderate, which resulted in an initial risk of medium. When we first evaluated, they added in the money that's coming, the expectation of this money, and purchasing of more PPE and the repair of BSC. And so they were able to reduce the likelihood to unlikely. And then they added with those added additional controls. And as you can see, if the likelihood is unlikely and the consequence is moderate, it is now a low risk. And so that is the last example. I'm trying to rush through this and I apologize for speaking so quickly, but I really want to have time for questions, and I don't want to dwell too long on that. So now some final things, particularly the risk assessment framework. We went through all of the steps in the risk assessment framework, from gathering information, evaluating risks, developing the risk control strategy, selecting and implementing risk control measures, reviewing risks and risk control measures, and then finally, that is the piece that we didn't go into very much. I touched on it, but it does circle back around. It's not a linear process. And so for reviewing risks, I'm going to go through this fast because we've already mentioned it, but it's extremely important to the process, whether there's been any changes, and also to have a periodic review for your risk assessments, whether it's once every year, once every 6 months, whatever your lab decides is appropriate based on maybe that test or that procedure. You need to evaluate, particularly if there are incidents, because what that tells you is that your risk controls are not working. Either it could be training for your staff, which is more than likely. Usually that's how incidents occur, from staff members being careless or ill-trained or something like that. I mean, it's true. So that tells you that you need to review at that point. So, final thoughts. Here are some key considerations for each of these steps in the risk assessment process. When you're gathering information, you need to consider what biological agents will be handled and what their pathogenic characteristics are. That determines mostly consequence. Evaluate the risk. How can an exposure or release occur? Develop a risk strategy. What risk control strategies are most applicable for the resources you have available? Selecting and implementing control measures. What measures are locally available and sustainable? Again, we're looking at resource availability, and that will help you to decide what risk control measures you can use. And then finally, the importance of the review process, which we just went through. But a list of all these factors are also available that affect likelihood and consequences. There are many more than the ones that I've shared. They're in the monograph. And one important, I've touched on GMPP, but I want to say that this is kind of the foundation of laboratory work and ensuring that staff are doing the appropriate thing. It goes a very long way in preventing incidents or exposures. Employing best practices, technical procedures that allow one to avoid inhalation. I've given several examples of how that can be done. Avoiding ingestion and contact with skin and eyes. A face shield would be one way to prevent that, using that PPE. Avoiding injection, substitution, glassware to plasticware, and preventing dispersal. Waste containers, using them appropriately, decontaminating surfaces frequently, and so on. Probably the most important, as I just stressed, is personnel competence and training. Personnel should not only have job-specific training and understand the procedures that they're doing, but also be acutely aware of risks or hazards in their laboratory, and then understand the principles and practices of biosafety and biosecurity. GMPP is actually the most essential risk control measure because human error, suboptimal laboratory techniques, and improper use of equipment has been found to cause most laboratory injuries and laboratory-associated infections. And then finally, the LBM-4 emphasize it is a risk and evidence-based approach to biosafety. Risk assessment, some of the main characteristics, it's situational, it's very flexible and globally applicable and therefore very equitable based on resources. It's intended to prevent exposure and release, and it's applicable to outbreak situations, as we just evidenced when we went through the exercises. Challenges, there are several challenges. There is need for training, not only in biological risk assessment, but also just in biosafety practices in general. There's a great need to share information about biosafety solutions and best practices, and also huge need to share lessons learned so people don't repeat each other's mistakes. And then that's my disclaimer I have to add. And the best part, acknowledging everybody who put so much work into this. I want to particularly acknowledge Catherine Summermatter. I borrowed a lot of her slides for this and made up several of my own, but she was a co-author, as many of these folks were. That's why they're listed in the risk assessment monograph. Obviously, Dr. Kojima, Alan Bennett, Stuart Plexell, Marianne Heiss, Michelle McKinney, and then we have with us today Kaz, I believe, and also Catherine Mackeson Booth and Rika Zinsky. And I'm so pleased that they're here. I just want to say a word about Rika. She is not only a biosafety subject matter expert, she is a prolific and superlative editor, and I appreciate her all the time. She did a lot of editing on the LBM4 and all the monographs. And then Catherine Mackeson Booth, who is also a biosafety SME, but she appears in the WHO GMPP videos. I provided a link for that when I spoke last. And also, she is working on developing a biosafety risk assessment tool. So we really look forward, that's kind of a teaser, but we really look forward to that and hearing more from Kat about this risk assessment tool. So thank you. And I'm so